Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
And welcome back. Most of us have taken them in our lifetime to help us get well. I'm talking about antibiotics, a group of very different chemicals that have the ability to destroy bacteria, but they have no effect upon viral infections. Joining us to take questions now on antibiotics is Express Care's Dr. Jitka Lom. Thank you so much for joining us again.
Hi, Mindy.
Let's talk a little bit about antibiotics. First off, what are they?
Well, the first most famous antibiotic was penicillin, and these are a group of chemicals, as you mentioned, medication that we can take in order to either kill bacteria or at least stop their growth. I think the best way to think about antibiotics is to think of them as tools that we give your own immune system so that it can heal. If you don't have an immune system and you take antibiotics, you still will not get well. But with antibiotics, in some cases, you can help your immune system to destroy the invader.
And so when you talk about the invader, when are they needed? When is a good time to take antibiotics?
Right. So antibiotics are indicated for infections that are caused by bacteria. Bacteria are large germs. They, common names would be staph, staphylococcus, or strep. We hear about strep throat. These are common bacteria that we have the tools to work against. Viruses, those are diseases, those are organisms that are very tiny, very sneaky, and they cause infections like hepatitis or AIDS, HIV, or just the common cold and flu. And antibiotics do not work on those, so it's a useless waste of money and time to be taking them.
Why is it that they don't work on the common cold and flu? Most people think, well, I'm sick, time to go get some antibiotics.
Right.
Why don't they work?
Well, because antibiotics are geared towards bacteria, which again are very large germs. It's sort of like saying, why doesn't a screwdriver work like a hammer? Mm-hmm. It just doesn't. Okay, it's not going to work in that particular field. We do have antiviral medications. Those are medicines that help destroy viruses. Those do exist for certain conditions, including the flu. We talked about Tamiflu last time, a medicine that works against the common flu. But antibiotics are reserved for bacteria.
Okay. Are there any side effects as a result of someone taking antibiotics?
There can be. Of course, we always hope that you won't have any side effects, but you might. Common ones would be nausea or vomiting, or a skin rash, headaches. These are common side effects of antibiotics, but there can also be more severe side effects, even life-threatening ones, allergic reactions that can lead to death. So we really don't prescribe them like candy.
When we hear about antibiotics, tell us about some of them. You mentioned the most common one. The first one was penicillin, right?
Right.
What other, I think amoxicillin, is that one of them?
Yeah,
what other kinds?
common antibiotics you might have heard of are amoxicillin, or Zithromax is common one, is Z-Pak. The way we classify antibiotics is whether they work against germs that are what we call aerobic, that live in the air, or that are anaerobic, that live without air. They might live in infections such as boils and so on, where there is no air, no oxygen getting in there. And so we classify antibiotics that work against aerobic and anaerobic bacteria. And then when you're choosing an antibiotic as a doctor, you try to think of what's the most likely germ causing this infection. And we know from experience, for example, that a sore throat is caused by strep, or that a urinary tract infection is caused by E. coli oftentimes. And so we'll select antibiotics that are most likely to kill that bacteria.
Okay, sounds good. Well, more Q&A with Dr. Lom right after this.